So we are at Addiction and Recovery Models, Session 4, Addiction and the Body. Last week we looked at addiction in the brain, and this session we're going to look at addiction in the body. Now the stats here are old, and I want to apologize for that. I will hopefully make a note, or maybe my TA can send me a note. Please update the stats. Illicit drug use in America has been increasing steadily for a long time. 2012, a study showed that an estimated 23.9 million Americans aged 12 or older, 9.2% of the population, had used an illicit drug or abused a psychotherapeutic medication, such as a pain reliever, stimulant, or tranquilizer, in the past month. This represents a 21.3% increase since 2008. The increase mostly reflects a rise in the use of marijuana. Now, because we have marijuana that's legalized in many jurisdictions, it says the most commonly used illicit drug. Now it's the most commonly used drug, and it is a drug, make no mistake. In spite of some jurisdictions legalizing the sale and use of marijuana, it is still illegal in most of America, and it is still federally prohibited. Marijuana use has increased since 2007. 2012, there were 18.9 million current users in the past month from when the survey was done, which is about 7.3% of the people aged 12 or older, up from 14.4 million, 5.8% in 2007. Use of most drugs other than marijuana has not changed appreciably over the past decade and has declined in some instances. In 2012, 6.8 million Americans aged 12 or older, or 2.6%, had used psychotherapeutic prescription drugs non-medically, without a prescription or in a manner or for a purpose not prescribed in the past month. And 1.1 million Americans, 0.4%, had used hallucinogens, a category that includes ecstasy and LSD, in the past month. Cocaine use has gone down in the last few years. From 2007 to 2012, the number of current users aged 12 or older dropped from 2.1 million to 1.7 million. Methamphetamine use has remained steady from 530,000 current users to 440,000. However, approximately 1.2 million people reported using methamphetamine in the past year. So they may not have used it in the month previous to this study, but they had in the year, sometime in the year previous. Most people use drugs for the first time when they are teenagers. What's sad about that statement is it's getting less and less true. We find more and more middle schoolers are being exposed to drug use and incorporating that into their lives. There were just over 2.8 million new users or initiates of illicit drug use in 2012, or about 7,898 new users per day. That's half of those were under 18. More than half of the new illicit drug users begin with marijuana. Next most common are prescription pain relievers, followed by inhalants, which is most common among younger teens. Drug use is highest among people in their late teens and 20s. In 2012, 23.9% of 18 to 20-year-olds reported using an illicit drug in the past month. Now, we're going to talk about alcohol in a minute, but this is drugs other than alcohol, okay? So this drug use is increasing among people in their 50s. This is at least in part due to the aging of the baby boomers, whose rates of illicit drug use have historically been higher than those of previous cohorts. I live in a 55 and older community, and it's not uncommon to walk by certain homes and smell marijuana. Okay. Well, part of that is because it's legal. Medical marijuana is legal, but also we've got a lot of aged hippies that live right here, right? And they've been using marijuana for 50, 60 years. Alcohol, drinking by underage persons has declined. Current alcohol use by this age group declined from 28.8 to 24.3% between 2002 to 2012, while binge drinking declined from 19.3 to 15.3%, and the rate of heavy drinking went from 6.2 to 4.3%. Binge and heavy drinking are more prevalent among men than among women. In 2012, 30.4% of men 12 and older, 16% of women reported binge drinking. That's 5 or more drinks on the same occasion in the past month. And 9.9% of men, 3.4% of women reported heavy alcohol use, binge drinking on at least 5 separate days in the past month. That's a lot of alcohol. Driving under the influence of alcohol has also declined slightly, but you have the increase of driving under the influence of marijuana. In 2012, an estimated 29.1 million people, or 11.2% of persons aged 12 or older, had driven under the influence of alcohol at least once in the past year. And remember, that's 12 years old or older. 12-year-olds aren't even supposed to be driving. But I can't even tell you how many times a 14, 15-year-old kid has been stopped driving a vehicle and been under the influence of alcohol or other drugs. Although this decline is encouraging, any driving under the influence remains a cause for concern. So then you've got some tables that show you, to give you kind of a visual. The first one is rates of alcohol dependence or abuse, how they declined from 2002 to 2012. Okay. You see, these are in numbers in millions, right? So in 2012, 17.7 million Americans, which is 6.8% of the population, that's higher than the unemployment rate, were dependent on alcohol or had problems related to the use of alcohol. This is a decline from 18.1 million, or 7.7% in 2002. The second table shows after alcohol, marijuana has the highest rate of dependence or abuse among all drugs. 2012, 4.3 million Americans met clinical criteria for dependence or abuse of marijuana in the previous year, more than twice the number for dependence abuse of prescription pain relievers, 4 times the number for dependence abuse of cocaine. So those are pretty high numbers. And now with it being more legal and more accessible, those numbers are even higher. So let's move on to understanding disease. Now, we've been talking about this a lot. We need to understand this. We need to have a very nuanced understanding of the disease model. So last time we discussed the correlation between addiction and the brain. As we saw, most of the conclusions derived from the studies that have been done has brought results summarized with words and phrases like hypothesized, assumed, theorized, suggested, and supposed. On the other hand, there's a great deal of empirical evidence for the psychological or physiological impact of addictive substances on the body. Our bodies are made entirely of cells, over 200 types, and about 50 to 70 trillion of them. When these cells become laden with toxins, the result is cellular inflammation, hormone imbalance, and disease. If we understand at the base of all degenerative disease is cellular inflammation, we can understand why this is so significant. So our bodies were designed to be self-healing when they're provided with the nutrients that they need. Our bodies were designed for food, not product. Product is man-made chemicals, which are toxic and which our bodies turn into waste, fat, or disease. The only thing our bodies do with that, they either turn it into waste, turn it into fat, or turn it into disease. Now, the greater the toxicity of what a person ingests, the greater the health dangers. Prolonged and repeated ingestion of noxious, even hazardous chemicals dramatically impacts not just one, but all of the body's systems. We have to understand that the body's systems are interdependent, but interdependent. They're independent and interdependent. They function on their own, but they don't function completely alone. They interact with the other systems of the body. So this is because, just as with an automobile, the body systems are not simply independent, they are interdependent as well. When one system becomes diseased and begins to break down functionally, this begins to affect the other systems. Think of how one moldy strawberry in a basket can spoil all the rest, right? So each drug affects your body in different ways. In addition, the long-term effects of drugs are different from the short-term effects. You take stimulants like cocaine, crystal meth, and amphetamines, they give an increased amount of energy. Repeated use of stimulants can cause violent behavior, panic attacks, psychosis, and mood swings. People who abuse stimulants also have a much increased risk of heart attack or stroke. And then you move into opioids like heroin, Vicodin, Percocet, and OxyContin. What? Percocet, OxyContin are grouped with heroin? Absolutely. These depress respiration, so people who use opioids can develop pulmonary issues, such as pneumonia or chronic bronchitis. They also have a risk of developing collapsed veins, liver disease, and infections in the heart and the valves of the heart. Then you look at depressants like Ativan, Xanax, and Klonopin. These slow brain function, which often causes people to lose concentration easily, become dizzy and fatigued. And then you look at the long-term effects of depressants, include sexual problems, sleep problems, breathing difficulties, chronic fatigue, and depression. Wait a minute. I'm trying to get rid of depression and this is making me more depressed. Well, that doesn't make any sense. These drugs also increase the risk of developing high blood sugar and diabetes, right? Because the liver and the pancreas have to deal with these things. Hallucinogens can have psychological and physical effects on your body. Users can become paranoid, have mood swings, have outbursts of violence, or develop extreme depression. Well, guess what? That sounds a whole lot like bipolar. When we take a look at the bipolar medications, these are the symptoms of the bipolar meds. Eventually, a chemical dependency to the drug develops. People continue to use drugs because they don't like the way their body feels when they come down from their high. The vicious cycle continues until their body develops a tolerance to the drug, which causes them to consume it in higher doses. Over time, a chemical dependency develops and their body doesn't function correctly without the drug. Now, according to the National Institute on Drug Abuse, addiction occurs when a chemical dependency to a drug is combined with an overwhelming urge to use the substance. Remember, that urge, that craving, is a mental, emotional thing, right? It's not physiological, it's mental and emotional. So then we've got a diagram that provides a snapshot of which organs are impacted by the most commonly misused substances other than alcohol, right? So you see this diagram, and you can take a look across the top of the diagram. You see cocaine, heroin, tranquilizers, meth, hallucinogens, PCP, marijuana, and steroids. I love hallucinogens. They got a mushroom, right? Magic mushrooms, if anybody remembers. Okay, so let's take a look at the brain, right? You see that cocaine, heroin, tranquilizers, meth, hallucinogens, PCP, marijuana, and steroids all affect the brain. So there's the brain is impacted by every single one of these categories. Okay, we move down to the jaw. Okay, again, cocaine, heroin, meth, steroids, PCP, and marijuana. Why does that matter? Okay, well, because what happened? Allison, what is the lower jaw there for? What does it do? Why is it important for that to be stable and healthy? You're muted.
Well, it opens and closes your mouth. It allows you to talk, speak, eat, swallow.
Breathe, right?
Yeah.
Yeah. Plus, it also actually affects balance as well, right? So then we take a look. So we can go all the way down. We can take a look at lungs and heart. Heart is impacted by all 8. The liver, stomach, kidneys, pancreas, intestines, reproductive organs. Look at this. There's not one area of the body that's not significantly impacted by these drugs, right? And many systems of the body are simultaneously impacted in a negative way by these drugs, right? So if you take a look at cocaine, right, there's not a single system of the body that's not negatively impacted by cocaine, right? Same thing with heroin. Matter of fact, heroin is so pernicious that it takes 2 to 5 years to detoxify the brain and the body from heroin, because heroin has to have been designed by Satan himself. Somebody had to sell their soul to Satan to come up with heroin, because heroin actually gets down into the nucleus of every cell in the human body, 50 to 70 million cells in the human body. Okay. Heroin hijacks the entire cellular system and the metabolism and everything in the body and the brain. It is one of the most, but the thing is, remember, what's the base of it? It's an opioid. So you have others that impact that, right? Like some of your pain meds that have the same impact. They affect the brain in the same way, and they affect the body almost as badly. Anyway, so as you can see, there's no biosystem in the human body not impacted by the ingestion of these substances. And when we look at the chemical composition of these substances, we find hundreds of heavy metals, neurotoxins, endocrine interrupters, and hormone disruptors. In other words, there is nothing good that comes out of any of these. So then we move on to the next page, where we've got the following guide shows which biosystems are impacted in what ways and by what substances. So take a look at cocaine. You get the nervous system, circulatory system, endocrine system, and the reproductive system. So it causes irreversible damage to the nervous system, can lead to blindness or stroke. Circulatory system causes blood vessels to restrict, increases blood pressure. People can end up with all kinds of problems because of high blood pressure, right? And the endocrine system affects neuroendocrine systems such as the adrenal glands. Reproductive system can cause infertility and decrease sex drive. Heroin, the extra opiates and dopamine can change the chemistry of the brain. Not just, and we don't talk about brain chemistry as a thing, but all the neurotransmitters in the brain get impacted by heroin. We take a look at the circulatory system. It can lead to bacterial infections in blood vessels and the heart, because the body's immune system gets broken down and compromised. Endocrine system can lead to kidney or liver disease, and the reproductive system can cause infertility. PCP isn't used very much. What's interesting about PCP is even though marijuana is legal in a lot of jurisdictions, there are people who prefer street marijuana, and ever since the early 70s, it's not uncommon to find street marijuana laced with PCP. But PCP is also a party drug in some places. So you see it disrupts NMDA receptors in the nervous system, affecting learning and memory. It increases blood pressure, heart rate, and elevates body temperature. PCP use can lead to kidney damage and disease. And it causes infertility, cause brain damage to a fetus. Marijuana, THC can cause impaired coordination, schizophrenia, and depression. Can also cause significant paranoia. Okay, I can remember people I was in high school with. You could tell they'd been smoking marijuana because they were so paranoid. They were so fearful that somebody was out to get them and they were going to suffer severely. It increases risk of heart attack and arrhythmia. Long-term use of marijuana can alter thyroid and growth hormones. Think about that. It's one of the reasons why when we sit down to do a counseling, we do do our basic information. I don't like to call it intake, but we do our basic information form. Okay, get your basic information, but really consider using the more in-depth form. Find out if they've had illicit drug use or even pharmaceutical use. We'll talk about that next time. Because some of the health problems that are making their mental and emotional struggles greater are rooted in that drug use. Steroids, of course, affects limbic system, learning, memory, causes increased aggressiveness. It affects blood lipids and enlarges ventricles, can lead to kidney damage and causes testicular atrophy and affects menstrual cycle in women. Then you got tranquilizers, meth, hallucinogens. We're not going to get into all these, but think about hallucinogens. Can lead to Parkinson's disease, schizophrenia, Alzheimer's, and senility. One of the questions I've asked several people who are in their 70s and 80s who are in that trajectory of dementia and Alzheimer's, I was just kind of curious. So did you do any mushrooms or anything like that, or LSD or anything like that when you were in high school or college? And it's amazing how many of them have or had. Those toxins may still be in their brain. So we've seen how these chemicals negatively impact the brain and the body, right? And the body's systems. Now let's talk about alcohol or drug withdrawal. Withdrawal refers to the physical problems and emotions a person experiences once a chemical dependency on a substance, such as alcohol, prescription medicines, or illegal drugs, has occurred, and then its use is stopped suddenly or is drastically reduced. Symptoms of withdrawal are caused by decreased amounts of alcohol or drugs in the blood or tissues of a person who's grown accustomed to prolonged heavy use. So withdrawal syndrome is a set of symptoms that occur when a person decreases or stops drinking or using drugs after prolonged use. I got to tell you, I missed that word syndrome. What is now called disorders used to be called syndromes. So what it says, we have this cluster of symptoms and it's a syndrome. They go together and this is how we understand it. We don't use that language much anymore and it's too bad. So let's talk about alcohol first. So symptoms of alcohol withdrawal may begin from 4 to 12 hours after a person cuts down or stops drinking, or as long as several days after the last drink, and can last a few days. Symptoms can range from mild to life-threatening. Can't remember who it was. Someone was talking to me earlier last week or two about someone who had drank so much when they were young that they ended up going in for surgery. I can't remember, liver or kidney surgery. And there were pockets of alcohol all throughout the body. And the person couldn't recover from the anesthesia because these pockets of alcohol were getting broken open and the alcohol was being absorbed into their system. They ended up I can't remember. I think they eventually died from it all, if I remember right. I'll have to ask. But when it says mild to life-threatening, we're not kidding. Mild withdrawal symptoms may include intense worry, nausea or vomiting. See, we have both an emotional and a physical. Shakiness, sweating, feeling a little tense or edgy. Severe withdrawal symptoms may include being extremely confused, jumpy, or upset. Feeling things on the body that are not there. They got bugs crawling on me. Seeing or hearing things that are not there. And severe trembling. Life-threatening symptoms of withdrawal are called delirium tremens, DTs. Symptoms of DTs include all the symptoms listed above plus seizures. Untreated DTs can lead to death. Really severe, really, really severe. I had an uncle that went through that. He ended up with being in the hospital for some reason. At about day 5, he started to experience DTs. It was horrible. Prescription medicines or illegal drugs. Now, symptoms of withdrawal from either illegal drugs or prescription medicines depend on the drug or combination of drugs. If you want more insight into prescription medications, especially when it comes to the psychotropics, Dr. Bregan's book, Your Drug May Be Your Problem, was really helpful. So common withdrawal symptoms include anxiety, nausea, vomiting, drenching sweats, chills, tremors, diarrhea, hallucinations, insomnia, breathing problems, abdominal pain, seizures, death. If physical chemical dependency is developed and a person is experiencing symptoms of withdrawal, a visit to the doctor needs to take place right away. Okay. They need medical attention because this is a medical problem. This is not a psychological problem. It's not an emotional problem. This is what's happening to their body, and they're going to need some help. Tell you what, we can do a little conversation, and then we'll get into nutrition and healing the body after the break. So what are your thoughts on what we covered so far on this part? So let's move into this next section. We're going to talk about nutrition and healing the body. It is important to keep in mind that we as human beings are synergistic wholes. We are mental, emotional, spiritual, and physical. So just as proper nutrition is important for overall health and wellness in general, it is even more important when a person is battling against the physiological destruction wrought by the abuse of substances. Substance abuse harms the body in 2 distinct ways: via the effect of the substance itself and via negative lifestyle changes, such as irregular eating habits and poor dietary intake, and even something as simple as lack of hydration. So, for example, infants who were exposed to alcohol while in the womb often will have both physical defects and mental disabilities. In this case, the growing fetus has deficits both directly caused by the substance crossing the placenta and indirectly due to inadequate nutrition of the mother while she was drinking. Physical recovery from substance abuse involves many different components, including proper organ functioning, assuring mental well-being, and proper metabolism. The reason proper metabolism is so important is because metabolism is what makes everything work. A huge factor in the healing process is proper nutrient supply. Nutrients are essential not only for proper biosystem functions and energy, they also help fight off infection and help keep the immune system strong. One of the things that will happen when a person gets off of drugs, alcohol and other drugs, AOD, is they are immune compromised and they're actually going to be more susceptible to sickness. Though it is clear that substance use in general is not healthy, like anything else, different substances have different effects on the body. We saw that in our chart earlier. The following are a few of the more popular drug categories and how they each can affect body functioning. So let's look at opiates, not counting prescription medications. Codeine, morphine, heroin. All of these affect the gastrointestinal system. One of the main symptoms associated with opiate use is constipation. When a person is constipated, their body is unable to get rid of the toxic waste it is producing, and the potential for degenerative disease is greatly increased. When one withdraws from opiates, classic symptoms of withdrawal include diarrhea, vomiting, and nausea. The danger here lies primarily in a depletion of valuable nutrients and electrolytes. This includes imbalance in the amount of potassium, sodium, chloride, and calcium. Electrolytes are important for a variety of things, including proper cardiac or heart functioning. To combat the severity of these symptoms, one should eat meals that are balanced, proper amounts of vegetables, grains, fats, proteins, a high fiber diet with things such as whole grains, beans, peas, and vegetables is advisable due to constipation associated with opiate use. So one of the things in our residential program that we always ensured or worked on ensuring was proper diet. And of course, there's a rebellion against that because they're so accustomed to feeding the appetites of the flesh with drugs, alcohol, other drugs, right? Or alcohol and other drugs, that there's a sense of entitlement to satisfy the desires of the flesh. But it actually can cause their health to deteriorate rather rapidly if we don't bring in proper nutrition. Out of all the drugs utilized in the United States, alcohol is the major cause of nutritional deficiencies. The most prominent deficiencies include the following: pyridoxine or vitamin B6, thiamine, and folic acid. So an individual lacking in these nutrients may develop anemia. For women, a deficiency in folic acid can cause poor pregnancies. Vitamin B deficiency can also cause neurological problems. Lack of thiamine, which is B1, can lead to Korsakoff syndrome. And this is a neurological disorder manifested by the inability to form new memories. Severe loss of memories formed before the onset of the condition. Invented memories, which are then taken as true due to gaps in memory, sometimes associated with blackouts. Minimal content in conversation, lack of insight, and apathy. The person loses interest in things quickly and generally appears indifferent to change. Okay. Huge impact of lack of vitamin B1, right? And it's important to understand that it is not necessarily the AOD that causes the disorder, but the negative effect of AOD on the absorption of nutrients that is damaging. Okay, so now let's look at alcohol. Alcohol damages the liver and pancreas in particular. These two organs are necessary for detoxification and processing, liver, and the pancreas affects blood sugar and absorption of fat. If these two organs are not working properly, one can have an imbalance of fluids, calories, and electrolytes. Permanent damage can take place in the form of cirrhosis, which often results in liver damage, diabetes, seizures, malnutrition. Now, cirrhosis is a complication of many liver diseases characterized by abnormal structure and function of the liver. The diseases that lead to cirrhosis do so because they injure and kill liver cells, after which the inflammation and repair that is associated with the dying liver cells causes scar tissue to form. The liver cells do not die, that do not die multiply and attempt to replace the cells that have died. This results in clusters of newly formed liver cells, what they call regenerative nodules, within the scar tissue. So it's the, putting old wine into new skin, wineskins. Liver damage can also result in decreased clotting factors, which means an individual has a chance of bleeding unnecessarily. Women also have an increased risk for osteoporosis and may require significant supplementation. Use of opiates and alcohol can lead to a decrease in appetite and weight loss, which will eventually lead to malnutrition. Because one of the things that will happen is people will use alcohol or other drugs instead of eating. So they actually can end up starving themselves, end up suffering from malnutrition, which has significant and long-term negative effects on every system in the body. And it takes a long time to recover from. You can't live like this for 3, 6, 8 years. Decide, okay, I'm going to eat healthy for a few days and suddenly be well. Some of the damage will never be recovered from, because you can damage the body's systems to the point where they can't recover. As the name implies, stimulate the body, thereby causing many users to stay awake for unhealthy periods of time. And we all know that sleep deprivation has an enormous impact on mental, emotional, and spiritual health. This can range from one night of missed sleep to being awake for days at a time. This may result in dehydration and subsequent electrolyte imbalance. one should return to a normal balanced diet. This is often difficult given the abuse the body has suffered, especially if there's been severe weight loss. So what we're talking about here is we're not saying, okay, you have to completely change everything. But one of the things that I will often do is I'll say, let's add one healthy thing to your diet. We want you drinking water, not flavored water, not coffee, not tea. We want you drinking water. Okay, what we want to do is we want to take your weight, divide it in half, and we want your goal to be drinking that many ounces of water every day. That's what our goal is. Okay, even if you don't make it, that's what our goal is. Because water is one of the most restorative things that the body can ingest. And because without water, the body can't function. You can go for weeks without food, but you can only go a few days without water. And we just ask them to start adding one thing. Now, dealing with people who've developed some significant ongoing, some chronic problems, it's going to take a while. So they need to be prepared for no quick fix. They need to be prepared for investing in their own overall health over the long term, and understand that the improvements will be almost microscopic, so they won't even see it or feel it. They need to trust that this is God's design, and they need to employ this. Now, this is just dealing with the physical aspects, while you as a biblical counselor are also dealing with the mental, emotional, and spiritual aspects of this. We also need to remember they are a synergistic whole, and so what's happening to them physiologically is also an important aspect for us to discuss. So when we say that your body is a temple of the Holy Spirit, are you treating it that way? And he says we have this treasure in earthen vessels, so your body is also a treasure house. And it says that we are instruments in the Redeemer's hands, so your body is also a tool. Do we really see our physical bodies this way? You are not your own. You've been bought for a price. Do we really see ourselves that way? These are all things that are important, just as a believer in general, but especially if people have damaged themselves, wounded themselves through the abuse, use and misuse, abuse of drugs and alcohol. Let's talk about marijuana a little bit. Marijuana can increase appetite, which in chronic users can lead to being overweight. And for these individuals, probably best to cut back on sugar, fat, and overall calorie intake. And we're not talking about healthy fat, we're talking about unhealthy fat. Okay? Because usually people want the rush that comes from complex carbohydrates. They want processed sugar. They get the munchies, that kind of stuff, right? Something that's going to activate the reward centers in the brain. So summary, when people feel better, they're less likely to return to substance abuse. So while feeling better physically is not the primary goal, it is an important aspect of helping our counselees be better stewards of the body that God has given them. And since balanced nutrition helps improve mood and health, it is important to encourage an improved diet in people recovering from alcohol and other drug problems. This includes breaking free of psychotropic use. So individuals recovering from substance abuse have just given up a huge part of their life. And for this reason, it is part of helping these individuals accomplish the goal of not using again when not using is not the key focus. So as we talked before, what we focus on is what we hit. So if we're focusing on not using, using becomes the focus, which is where they're going to end up. So we want to shift the focus. So perhaps the most significant thing for prior substance abuse abusers to remember is routine. For instance, regular meals throughout the day are best. An increase in proteins, complex carbohydrates, and dietary fiber are highly recommended. Now, due to the irregularity of diet that tends to accompany substance abuse, most individuals will need a supplement diet with the most bioavailable supplements they can find. So keep in mind that the majority of what is available on the market today is loaded with petrochemicals, isolates, toxins. So organic whole food supplements is the best way to go. And there are lots of them that are available. It's much more available today than there were 10 years ago. And the reason we talk about organic whole food is because your body is designed to work being fueled by food, not product. So the healthier that any kind of supplementation they use, the better, because their body is not going to be, again, trying to process these chemicals out. As many AOD abusers do not eat regularly, they may forget what it feels like to actually be hungry. Not eating steadily can cause a fluctuation in blood sugar levels, which can lead to feelings of unsteadiness throughout the day. For a recovering addict, these feelings can be easily interpreted as drug cravings. Remember, I feel bad, I need to feel better, and this is what I know will help me feel better. So this in turn can trigger the need to use when the real need is healthy food. This is yet another reason to keep a steady and healthy intake of food, and giving them a food diary to keep, just to keep track of, to see what they're eating. Did I make sure that leafy greens were a part of what I ate today? Did I reduce the number of Twinkies or M&Ms or whatever in my diet? Did I add in some healthy grains, or did I add in fruits? Did I add in other vegetables? Did I add in healthy meats? Did I add in, healthy fats? Am I adding these things in? Because what happens is our body knows what it needs. It's how God created it. So as we start adding in healthy foods, our body says, yes, I want more of this. So the old cravings for the things that aren't healthy get replaced with a craving for the things that are healthy. And it's a process, it's an ongoing incremental process. But having them keep a food diary can help them stay focused on eating healthy. Now let's talk about hydration. We mentioned it a moment ago, but hydration is also a key factor in nutrient balance and biosystem function. Dehydration is common for substance users and is very important to emphasize the need for fluids throughout the day, especially water. As a person's appetite can return during the healing journey, it is important to emphasize both fluid intake and proper food consumption. What's interesting is sometimes they can feel hungry when they're actually thirsty. A lot of times they can't tell the difference. So when they feel hungry, if they start to feel hungry, say, have a drink of water and see if you're still hungry. Because once they start getting nutritious food, it's easy to overeat because they still need a good hydration. And if they're not getting it, they can feel hungry when actually they're thirsty. For all the reasons discussed already, it would be detrimental to a person's healing journey away from substance abuse to begin eating the high-calorie, low nutrition foods. The abuse the body has already endured is more than enough. Drinking water will help the body to absorb nutrients, which is something most of these individuals are lacking. Substance abuse recovery is a difficult road to follow. Good nutrition is something that can help to make that road a little easier to travel. Encouraging healthy eating as part of a healthy lifestyle is part of being a better discipler to these folks. And remember, taking care of our bodies is part of our stewardship as godly believers. Okay, so that's all I have for this session for this evening. Thoughts, questions, feedback? Kelly, I know one of the things you talk about with your counselees is how much rest they're getting, right? Rest is part of nutritional health. We don't think of it that way. But how are you sleeping? I know that's a question that you ask often. How are you sleeping? Because if a person isn't being able to sleep and get restful sleep, their body's not going to be able to metabolize the nutrients they're taking in. So sleep is an important part, not just of mental processing, but being able to be nutritionally healthy and balanced.
Yeah, it's always kind of interesting to see the correlation between not sleeping well and depression and anxiety specifically.
We have to understand when people are struggling with emotional challenges that are labeled anxiety and depression. Okay. A lot of people discount this, but gut health is going to be severely impacted. Okay. Gut health our gut health determines 80% of our overall health and well-being. People who abuse alcohol and other drugs, their gut health is going to be out of whack. So they're going to be unhealthy at base. And that gut health does have a significant impact on what happens mentally and emotionally. It does not determinative, but it has a huge impact, and vice versa. When you're under a great deal of stress, that impacts your gut health. So helping them understand that good nutrition is going to be important for their gut health was important for their overall health, but also it's going to have a huge impact on their mental and emotional baseline. I do have people push back in the biblical counseling world about that, and I want to say, and I asked them, show me any biblical warrant for not promoting good, healthy eating, and what science has shown us, demonstrated to us about what's important for overall good health. You can't show me any biblical warrant for not promoting that as part of ministering to the whole person. So I know it sounds counterintuitive when we're doing abuse healing groups and we've got chocolate on the table, but get healthy dark chocolate, right? Then you're okay.
How about people that are getting off of heroin and are put on like methadone?
I'm not a fan of methadone. You're just changing one addictive substance for another. It doesn't have the same neurobiological impact or impact on the total cellular structure of the body, but it's still an addictive substance. So one of the problems is many of the people that go on methadone never get off, and many of them will go back to heroin. Actually, it can be a stopgap for a minute to start moving a person in a direction, but it's not an answer. What's been your exposure, your experience with people doing methadone?
So as you said, they either go back to heroin or meth, or really just fall off the face of the earth, and I just don't hear from them again. I mean, it's hard to tell them, it's the same kind of thing because their minds are so caught up in like, this is helping me. This is helping me to get off the heroin, but it's really not.
Right, because the underlying cravings have not changed. The underlying need for self-medication isn't changed.
Yep. And that dependency of going to the methadone clinic every day, right? It's like you have to be there every day at this time, and their whole schedule is around this methadone clinic time.
Just like in addiction.
Can't get there on time. Yeah. It's like they can't get there on time, they're freaking.
Yeah, it's just an additional bondage. Just one more bondage. And in the residential programs that we've run, we've had heroin addicts come in. They have to be detoxed before they can come into the program. That's a must. Well, basic detox, because it's going to take 2 years to fully detox, 2 to 5 years. Okay. But giving them the opportunity to work on the underlying brokenness is absolutely critical. Absolutely critical. Okay. What other thoughts or questions do you have?
It's the same principle, like
So
if
I might,
somebody's in pornography and they replace it with more work. They just replacing one thing with the other. It's no help.
Yeah. Well, that is one of the things you'll find with people that are in these besetting sin bondages, right? Is that they will trade one idol for another. The idolatry hasn't been broken. The heart problem hasn't been addressed,
Right.
which is where biblical counseling is critically important, which is why you guys are doing the training that you're doing now, is to be able to address those underlying matters that have created and maintained these sin patterns, this
Right.
bondage that they're in, the underlying lies, the defective belief system that are rooted in lies. And it takes time. So this is why, as we've talked about before, it's important to see what kind of a support system you can recruit for them from among family members or people that are a part of the church fellowship they're a part of. It can't be just them meeting with you every week or every other week. That's not enough. It's not enough, especially those who have to live in the real world while they're trying to break this bondage. Right.
I'm a true believer about the nutrition and sleep, especially sleep. I've seen people, I've counseled people that hallucinate for like 30, 36 hours of not sleeping. They're
Yes.
seeing things.
Yes,
I
sleep
mean,
deprivation has an incredible impact on the brain.
it does. I've seen it. It's
Yeah.
very important.
Yeah. Okay.
You mentioned about the detoxification before coming to the program that you had the experience with. Where the detoxification takes place?
They have detox clinics all over the place.
So they have to go to a medical doctor to, okay.
Yeah, especially if they're coming off of heroin. Yeah, yeah. That takes medical attention. Yeah. Because all kinds of things can happen and go wrong quickly. So they need to be in a medical facility, detox facility for that. But that can be the case with people coming off of long-term alcohol use as well. So that's why, you know, as much as we're not fans of the secular world, there are times when what they provide is what's needed. And one of those specific medical detox facilities sometimes is absolutely, and I know for the biblical counseling programs, the Christian biblical counseling based programs, residential programs, a person can't detox on site. They have to get the recent spate of drugs or alcohol out of their system before they're able to go into the program. They have to go in a sober mind. Because it's just not, without having medical personnel on staff, it's an enormous risk. It's an enormous risk. One of the things that we used to do in the old safe house was their appointment for coming into the program was set to start when we picked them up when they walked out the door from detox. So they didn't have to catch the bus. They didn't have to try to find their own way. They didn't have to try. We were there waiting for them. And then then we asked them, do you still want to come into the program, or do you want to handle this on your own? If you want to come into the program, we have a place for you. We have a bed ready. Or actually, we would say we have a room ready. So, and they got to choose at that point. Do you want to continue this healing journey that you've already started? We've got a place for you. 9 times out of 10, they would take the option. Because again, they were sober-minded. They may be afraid, they may be intimidated by it, but we were not set up to deal with all that. And do you know how triggering it can be in that kind of a residential system for somebody to come in that's under the influence of drugs or alcohol like that? You can completely unhinge the whole program that way. It's irresponsible. Yeah. So, good.